The morning sun cast long shadows across the Naval Hospital as Admiral James Mitchell walked through the corridors with the confident stride that had carried him through 25 years of military service. At 52, he was the youngest Navy SEAL to ever achieve the rank of Admiral, a testament to his unwavering dedication and exceptional leadership skills. His broad shoulders and weathered face told stories of countless missions in hostile territories, but today, he was simply a patient arriving for what he believed would be a routine medical procedure. Admiral Mitchell had been experiencing persistent abdominal pain for several weeks. Initially dismissing it as stress from his demanding position overseeing special operations across 3 theaters of conflict, he had finally agreed to his wife Sarah's persistent requests to see a doctor. The preliminary tests had revealed the need for emergency surgery to remove what appeared to be an inflamed appendix that was on the verge of rupturing. Dr. Harrison Webb, the hospital's chief surgeon, had an impressive reputation that preceded him wherever he went. A graduate of Harvard Medical School with over 2 decades of surgical experience, Dr. Webb was known for his precision, his demanding standards, and his unwillingness to tolerate what he perceived as interference from nursing staff. His colleagues respected his surgical skills but often found his personality abrasive and his treatment of nurses particularly harsh. As Admiral Mitchell was wheeled into the preoperative area, he noticed the bustling activity of the medical staff preparing for his surgery. Among them was Maria Santos, a registered nurse with 15 years of experience in surgical care. Maria had earned her nursing degree while working night shifts to support her 2 young children after her husband's death in a construction accident. Her journey through nursing school had been challenging, but her natural compassion and attention to detail had made her one of the most respected nurses in the hospital. Maria had worked with Dr. Webb on numerous occasions and had developed a deep understanding of his surgical preferences and techniques. However, she had also witnessed his tendency to dismiss nursing input and his habit of making decisions without consulting the broader medical team. Despite their professional differences, Maria maintained her focus on patient care, believing that every patient deserved the best possible outcome regardless of the interpersonal dynamics in the operating room. The surgery was scheduled for early afternoon, giving Dr. Webb time to review Admiral Mitchell's medical history and the diagnostic imaging that had revealed the problematic appendix. The images showed clear signs of inflammation and the potential for imminent rupture, making the surgery both necessary and urgent. Dr. Webb approached the case with his usual confidence, having performed hundreds of similar procedures throughout his career. As the surgical team assembled in the operating room, Maria carefully checked and double-checked all the equipment and supplies that would be needed for the procedure. Her systematic approach to preparation had prevented countless complications over the years, and she took pride in ensuring that every detail was perfect before the surgeon made the first incision. She reviewed Admiral Mitchell's chart one final time, noting his military service record and the various injuries he had sustained during his career. Dr. Webb entered the operating room with his characteristic authoritative presence, immediately taking charge of the pre-surgical briefing. He outlined his surgical plan to the team, describing the approach he would take and the expected timeline for the procedure. As he spoke, Maria noticed something in the diagnostic images that gave her pause, but she decided to wait for an appropriate moment to share her concerns with the surgical team. Admiral Mitchell was brought into the operating room and positioned on the surgical table. The anesthesiologist began the process of sedating him while Maria and the other nurses continued their final preparations. As the Admiral drifted into unconsciousness, he had no idea that his life would soon depend on the courage and expertise of a nurse who was willing to speak up when others remained silent. Dr. Webb began the surgery with his usual precision, making the initial incision and carefully working his way toward the appendix. However, as he progressed deeper into the surgical site, it became apparent that the situation was more complex than the initial imaging had suggested. The inflammation was more extensive than expected, and the anatomy was slightly different from what the preoperative scans had indicated. Maria watched the procedure carefully, her trained eye picking up subtle signs that something was not proceeding as smoothly as Dr. Webb was indicating. She noticed changes in the Admiral's vital signs that suggested potential complications, and she began to feel a growing sense of unease about the direction the surgery was taking. Her experience told her that immediate adjustments to the surgical approach might be necessary. As Dr. Webb continued with his planned procedure, Maria's concerns grew stronger. She could see that the surgical field was becoming more complicated, with increased bleeding and signs that the inflammation had spread further than initially diagnosed. The Admiral's blood pressure was beginning to fluctuate, and his heart rate was showing signs of stress that suggested his body was responding to a more serious condition than a simple appendicitis. The tension in the operating room was palpable as Dr. Webb worked to control the bleeding and navigate the more complex anatomy he was encountering. Maria knew that she needed to voice her concerns, but she also understood the professional risks of challenging a senior surgeon during an active procedure. Her dedication to patient care ultimately overcame her hesitation, and she prepared to make observations that could potentially save Admiral Mitchell's life. Dr. Webb's frustration was becoming evident as the procedure continued to present unexpected challenges. The bleeding was more difficult to control than anticipated, and the inflammation was more widespread than the diagnostic imaging had suggested. Despite his years of experience, he was beginning to encounter a situation that required immediate reassessment of his surgical strategy. Maria had been monitoring not only the Admiral's vital signs but also the overall progression of the surgery. Her experience with similar cases had taught her to recognize the early warning signs of complications that could rapidly become life-threatening. She could see that the current surgical approach was not adequately addressing the full extent of the Admiral's condition, and she knew that alternative strategies needed to be considered immediately. The Admiral's condition began to deteriorate more rapidly as the surgery progressed. His blood pressure dropped significantly, and his heart rate became erratic, indicating that his body was going into shock. The anesthesiologist called out the changing vital signs, adding urgency to an already tense situation. Dr. Webb was working frantically to control the bleeding and stabilize the surgical site, but his efforts were not producing the desired results. Maria realized that the moment had come when she could no longer remain silent. The Admiral's life was hanging in the balance, and her professional expertise was telling her that a different approach was urgently needed. She had identified potential solutions that could address the complications they were facing, but she knew that suggesting alternative strategies to Dr. Webb during surgery would likely result in a confrontational situation. The operating room fell into a hushed tension as Admiral Mitchell's vital signs continued to decline. The surgical team was working with increasing urgency, but Dr. Webb's original surgical plan was proving inadequate for the complex situation they had encountered. Maria could see that without immediate changes to their approach, the Admiral might not survive the procedure that was supposed to save his life. As the minutes ticked by, Maria weighed her options. She could continue to follow Dr. Webb's lead and hope that his experience would ultimately prevail, or she could risk her professional standing by challenging his surgical decisions in front of the entire operating room team. The Admiral's deteriorating condition made the choice clear: patient care had to take precedence over professional hierarchy and personal consequences. The surgical monitors continued to sound alarms as Admiral Mitchell's body struggled to cope with the trauma of the complicated procedure. Dr. Webb was visibly stressed as he worked to regain control of the situation, but his efforts were not producing the stabilization that everyone in the room desperately wanted to see. The moment of decision had arrived, and Maria knew that her next actions could determine whether the Admiral would survive to see his family again. Standing at the edge of the surgical field, Maria took a deep breath and prepared to speak the words that would either save a life or potentially end her career. The weight of her 15 years of nursing experience, her dedication to patient care, and her professional oath all converged in this critical moment. Admiral James Mitchell's life hung in the balance, and Maria Santos was about to make the most important decision of her nursing career. Maria Santos had seen enough. Admiral Mitchell's blood pressure had dropped to dangerously low levels, and the monitors were screaming warnings that everyone in the operating room could hear but seemed powerless to address effectively. Dr. Webb was deep in the surgical site, his hands working frantically to control bleeding that seemed to worsen with each passing minute. The surgical field was becoming increasingly chaotic, and Maria could see signs that the Admiral was going into hypovolemic shock. "Dr. Webb," Maria said firmly, her voice cutting through the tension in the operating room. "I need to speak with you about the patient's condition." Dr. Webb looked up from his work, his face flushed with frustration and concentration. Sweat beaded on his forehead despite the cool temperature maintained in the operating room. "Not now, nurse," he snapped. "Can't you see I'm trying to save this patient's life?" Maria stood her ground, knowing that this was the moment that would define not only her career but, potentially, the Admiral's survival. "Sir, with respect, I believe we need to consider that this may not be a simple appendicitis. The bleeding pattern and the extent of inflammation suggest we might be dealing with a perforated bowel or possibly necrotizing fasciitis." The suggestion hit the operating room like a thunderclap. Dr. Webb's hands paused for a moment as he processed what Maria had said. Necrotizing fasciitis was a rapidly spreading bacterial infection that could kill a patient within hours if not properly treated. It required a completely different surgical approach than the appendectomy he had been performing. "That's impossible, Dr. Webb said, his voice tight with authority and barely controlled anger. The imaging clearly showed appendicitis. "I've been doing this for 20 years, and I know what I'm looking at. Continue with your nursing duties and let me handle the surgery." But Maria had been studying Admiral Mitchell's case more carefully than anyone realized. During her preoperative preparation, she had noticed subtle signs in his medical history that suggested a more complex condition. The Admiral had mentioned experiencing flu-like symptoms for several days before the abdominal pain began, and he had a small cut on his leg from a training exercise 2 weeks earlier that had been slow to heal. "Doctor, please look at the tissue around the surgical site," Maria persisted, knowing she was crossing a line that could cost her everything. "The discoloration and the smell are consistent with necrotizing infection." The Admiral's white blood cell count was elevated beyond what we typically see with appendicitis, and his temperature spiked just before surgery. Dr. Webb's face turned red with fury. "You'll make it worse," he cried, his voice echoing off the sterile walls of the operating room. "I will not have a nurse second-guessing my diagnosis in my operating room. If you can't support this surgical team, then you can leave immediately." The other members of the surgical team exchanged worried glances. They could see Admiral Mitchell's condition continuing to deteriorate, but they also understood the professional hierarchy that governed their workplace. Challenging a senior surgeon was career suicide for most medical professionals, but Maria had spent too many years caring for patients to back down when she believed a life was at stake. "I'm not leaving this patient," Maria said with quiet determination. "And I'm requesting that we call for a surgical consult immediately. Dr. Peterson from Infectious Disease should examine this patient before we proceed further." Dr. Webb slammed his surgical instrument down on the tray, causing everyone in the room to jump. "Absolutely not. I am the attending surgeon, and I make the decisions about patient care. You are way out of line, and when this surgery is over, I'm reporting you to the nursing supervisor for insubordination." Maria felt her heart racing, but she also felt the steady resolve that had carried her through 15 years of nursing challenges. She looked at Admiral Mitchell's pale face and thought about his wife Sarah, who was waiting anxiously in the family waiting area, trusting that the medical team would bring her husband back to her safely. "Then, I'm requesting that you at least examine the tissue samples under magnification," Maria said, her voice steady despite the emotional storm raging inside her. "If I'm wrong, I'll accept full responsibility for disrupting this procedure. But if I'm right, we could save the Admiral's life by changing our approach now." Dr. Webb was about to respond with another angry dismissal when the anesthesiologist spoke up. "Doctor, the patient's blood pressure is continuing to drop. We've given him maximum fluid resuscitation, but he's not responding as we would expect for a routine appendectomy." The supporting evidence from another medical professional gave Maria the opening she needed. "The infection may have spread to his bloodstream," she said. "That would explain why his body isn't responding to standard treatment. We need to consider aggressive debridement and broad-spectrum antibiotics immediately." Dr. Webb looked around the operating room, seeing doubt beginning to creep into the faces of his surgical team. Admiral Mitchell's vital signs were indeed more unstable than anyone had anticipated, and the surgery was taking much longer than a routine appendectomy should require. The evidence was mounting that something more serious was happening. "Fine," Dr. Webb said through gritted teeth. "But when this proves to be nothing more than a complicated appendicitis, you're finished in this hospital." Maria nodded, accepting the risk she was taking. "I understand, doctor. But right now, the Admiral needs us to consider every possibility." Dr. Webb reluctantly called for a tissue sample to be prepared for immediate microscopic examination. The pathology technician rushed the sample to the lab while the surgical team worked to stabilize Admiral Mitchell's condition. The next few minutes felt like hours as everyone waited for results that would either vindicate Maria's concerns or end her nursing career. When the pathology results came back, the operating room fell silent. The tissue sample showed clear evidence of necrotizing fasciitis, a flesh-eating bacterial infection that had already begun to spread beyond the appendix. Dr. Webb stared at the lab report, his face pale with the realization of how close he had come to missing a diagnosis that could have killed Admiral Mitchell. "Call Dr. Peterson immediately," Dr. Webb said quietly, his earlier anger replaced by professional urgency. "And, get me a complete surgical debridement kit. We need to remove all infected tissue immediately." Maria felt relief flooding through her body, but she knew the real work was just beginning. Treating necrotizing fasciitis required aggressive surgical removal of all infected tissue, massive doses of antibiotics, and careful monitoring to prevent the infection from spreading further. Admiral Mitchell's life was still hanging in the balance. Dr. Peterson arrived within minutes, bringing with him years of experience in treating severe infections. He examined Admiral Mitchell's condition and confirmed Maria's assessment. "This patient is lucky," he said. "If we had continued treating this as appendicitis, he probably wouldn't have survived the night." The surgical team immediately shifted into a new mode of operation. Dr. Webb, despite his earlier resistance, proved his surgical skills by working with Dr. Peterson to carefully remove all infected tissue while preserving as much healthy tissue as possible. Maria coordinated the nursing care, ensuring that antibiotics were started immediately and that all surgical instruments were properly sterilized to prevent further contamination. As the revised surgery progressed, Admiral Mitchell's vital signs slowly began to stabilize. His blood pressure started to improve, and his heart rate became more regular. The aggressive treatment was working, but everyone in the operating room knew that the next 24 hours would be critical for his recovery. Maria worked with renewed energy, knowing that her willingness to challenge authority had potentially saved a life. She coordinated with the other nurses to ensure that every aspect of Admiral Mitchell's care was meticulously managed. The surgical site was thoroughly cleaned and debrided, removing all signs of the infection that had threatened to kill him. Dr. Webb worked with focused intensity, his earlier anger forgotten in the face of the medical emergency they were addressing. He and Dr. Peterson worked together to ensure that no infected tissue remained and that the Admiral's abdominal cavity was completely clean. The procedure took several additional hours, but slowly the surgical team gained control over the infection. As the surgery finally neared completion, Dr. Webb looked up at Maria with an expression that mixed grudging respect with lingering frustration. "Your intervention may have saved this patient's life," he admitted quietly. "But your method of challenging my authority was completely inappropriate." Maria nodded, understanding the complex emotions that Dr. Webb was experiencing. "I respect your surgical expertise, doctor. But I couldn't stand by and watch a patient deteriorate when I believed I knew what was wrong." The operating room began the process of closing Admiral Mitchell's surgical site and preparing him for transfer to the intensive care unit. His vital signs were stable but not yet strong, and everyone knew that the next phase of his recovery would require constant monitoring and careful management of his antibiotic treatment. As Admiral Mitchell was wheeled out of the operating room, Maria felt the weight of what had just transpired. She had risked everything to advocate for a patient, and, while the immediate crisis had passed, she knew that the professional consequences of her actions were still to be determined. Dr. Webb had made it clear that he intended to report her for insubordination, and Maria understood that her career at the hospital might be over. But, as she looked at Admiral Mitchell's face, peaceful now in sedated sleep, she knew that she had made the right choice. A Navy SEAL who had served his country with honor and distinction was alive because she had found the courage to speak up when it mattered most. Whatever happened to her career, she could live with the knowledge that she had put patient care above personal safety. Admiral James Mitchell's journey from the operating room to the intensive care unit marked the beginning of what would prove to be the most challenging battle of his distinguished military career. Unlike the conflicts he had faced in hostile territories around the world, this enemy was invisible, microscopic, and fighting for control of his own body. The necrotizing fasciitis that Maria Santos had identified was far from defeated, and the next 72 hours would determine whether the surgical intervention had been successful. Maria had volunteered to work additional shifts to help monitor Admiral Mitchell's recovery, despite knowing that her career at the hospital was likely in jeopardy. Dr. Webb had indeed filed a formal complaint against her for insubordination, and the hospital administration was conducting an investigation into her conduct during the surgery. But Maria's primary concern remained Admiral Mitchell's welfare, and she was determined to see him through the critical early stages of his recovery. The intensive care unit buzzed with activity as Admiral Mitchell was connected to multiple monitoring devices that would track every aspect of his physiological condition. His blood pressure, heart rate, oxygen levels, and brain activity were all displayed on screens that cast an eerie glow over his pale face. 4 lines delivered powerful antibiotics directly into his bloodstream, while other medications worked to support his cardiovascular system as it struggled to recover from the shock of severe infection. Sarah Mitchell had been informed about the complications during her husband's surgery, though the medical team had been careful not to share the full extent of how close he had come to dying. She sat beside his bed, holding his hand and speaking softly to him despite knowing that he couldn't hear her through the sedation. Her 23 years of marriage to a Navy SEAL had prepared her for many anxious moments, but nothing had quite prepared her for watching her husband fight for his life in a hospital bed. Maria checked on Admiral Mitchell every hour, monitoring not only his vital signs but also the surgical site for any signs that the infection might be returning. Necrotizing fasciitis was notorious for its ability to spread rapidly even after aggressive treatment, and constant vigilance was required to ensure that the bacteria didn't gain a foothold in healthy tissue. She carefully documented every change in his condition, knowing that early detection of any complications could mean the difference between recovery and catastrophe. Dr. Peterson had taken over as the primary physician responsible for Admiral Mitchell's care, working closely with Dr. Webb to monitor the effectiveness of the antibiotic treatment. The infectious disease specialist had seen many cases of necrotizing fasciitis throughout his career, and he understood the unpredictable nature of the infection. Some patients responded quickly to treatment, while others faced weeks or months of complications before achieving full recovery. On the second day after surgery, Admiral Mitchell showed encouraging signs of improvement. His white blood cell count was decreasing, indicating that his immune system was gaining control over the infection. His blood pressure had stabilized without the need for additional medications, and his kidney function was returning to normal levels. These positive indicators gave the medical team hope that the aggressive surgical intervention had been successful. Maria was working the night shift when she noticed subtle changes in Admiral Mitchell's condition that concerned her. His temperature had begun to rise slightly, and there was a faint redness around the edges of his surgical incision that hadn't been present earlier in the day. Her experience with post-surgical infections told her that these could be early warning signs of complications, even though the changes were too minor for most people to notice. She immediately contacted Dr. Peterson, who arrived at the ICU within 30 minutes to examine the Admiral personally. After careful evaluation, Dr. Peterson agreed that the signs Maria had identified were potentially significant. He ordered additional blood tests and a CT scan to determine whether the infection was beginning to resurge or if they were simply seeing normal inflammatory responses to the surgery. The test results revealed that while the infection hadn't returned in full force, there were small pockets of bacteria that had survived the initial surgical debridement. Dr. Peterson made the difficult decision to take Admiral Mitchell back to surgery for additional cleaning of the infected area. The second surgery was a setback that everyone had hoped to avoid, but it was necessary to prevent the infection from regaining strength. Maria was assigned to assist with the second surgery, despite the ongoing investigation into her conduct. Dr. Webb had specifically requested her presence, acknowledging that her expertise in recognizing infection signs had proven invaluable. The atmosphere in the operating room was markedly different from their first encounter, with a newfound sense of mutual respect replacing the earlier antagonism. The second surgery revealed that Maria's observations had been correct. Small areas of infected tissue that had been difficult to identify during the initial procedure were successfully removed, and the surgical site was thoroughly cleaned once again. Dr. Webb worked with meticulous precision, determined to eliminate every trace of bacteria that threatened Admiral Mitchell's recovery. Following the second surgery,
Admiral Mitchell's recovery progressed more smoothly.
His body began responding positively to the antibiotic treatment, and the surgical site showed clear signs of healthy healing. Maria continued her careful monitoring, checking for any indications that the infection might return while also watching for signs that the Admiral was beginning to regain consciousness. On the fourth day after the initial surgery, Admiral Mitchell began to show signs of awakening from sedation. His eyelids fluttered occasionally, and his fingers responded to gentle pressure from his wife's hand. Dr. Peterson gradually reduced the sedation medications, allowing the Admiral's natural consciousness to return while ensuring that he remained comfortable during the healing process. When Admiral Mitchell first opened his eyes, he was disoriented and confused by his surroundings. The last thing he remembered was being wheeled into surgery for what he believed would be a simple appendectomy. Sarah was there to explain what had happened, though she kept the details minimal to avoid overwhelming him during his initial recovery period.
Maria was present when Admiral Mitchell was fully conscious for the first time.
She introduced herself as one of the nurses who had cared for him during his surgery and recovery, though she didn't immediately explain her role in diagnosing his condition. The Admiral was still weak from his ordeal, but his eyes showed the alertness and determination that had carried him through decades of military service. As Admiral Mitchell's strength gradually returned, he began asking questions about what had happened during his surgery. Sarah and the medical team provided him with a basic understanding of the complications that had arisen, but it was Dr. Peterson who eventually explained the full extent of how serious his condition had been. "You had necrotizing fasciitis," Dr. Peterson explained during one of his daily visits. "It's a severe bacterial infection that can be fatal if not treated aggressively. The initial diagnosis was appendicitis, but one of your nurses identified signs that suggested a more serious condition."
Admiral Mitchell listened intently as Dr. Peterson described the events in the operating room. He learned about the disagreement between Dr.
Webb and Maria, and how her insistence on considering alternative diagnoses had likely saved his life. As a military leader, he understood the importance of speaking up when lives were at stake, regardless of rank or hierarchy.
Maria was checking Admiral Mitchell's vital signs when he asked to speak with her privately.
Sarah stepped out of the room to give them privacy, though she remained nearby in case her husband needed anything. The Admiral looked at Maria with the serious expression that his subordinates had learned to respect throughout his military career. "Dr. Peterson told me what you did in the operating room," Admiral Mitchell said, his voice still weak but filled with gratitude. "He said you challenged the surgeon's diagnosis even when you were told to stay quiet." Maria nodded, not sure how to respond to recognition from someone who had spent his career in situations where split-second decisions could mean life or death for entire teams of people. "In the military, we have a saying," Admiral Mitchell continued. "Mission first, people always. You put my welfare ahead of your own career, and I want you to know that I understand what that cost you." Maria felt tears forming in her eyes as she realized the depth of the Admiral's understanding. He knew that her actions had put her job at risk, and he appreciated the sacrifice she had made on his behalf. Admiral Mitchell's recovery continued steadily over the following days. His surgical site healed cleanly, with no signs of recurring infection. His strength returned gradually, and he was able to begin eating solid foods and walking short distances with assistance. The medical team was optimistic that he would make a full recovery, though it would take several weeks before he could return to his military duties. During his recovery, Admiral Mitchell learned more about the investigation into Maria's conduct. He discovered that Dr. Webb's complaint had resulted in a formal hearing that could result in disciplinary action against her, potentially including termination from her position. The Admiral realized that the nurse who had saved his life was facing professional consequences for her actions. As someone who had spent his career in leadership positions, Admiral Mitchell understood the importance of accountability and proper procedures. But he also understood that there were times when rigid adherence to hierarchy could cost lives. Maria's willingness to challenge authority when patient safety was at stake demonstrated the kind of moral courage that he had tried to instill in the soldiers under his command. Admiral Mitchell made a decision that would prove crucial in determining Maria's future at the hospital. He requested a meeting with the hospital administration to provide his perspective on the events that had occurred during his surgery. As a high-ranking military officer whose life had been at stake, his testimony would carry significant weight in the investigation. The stage was set for a confrontation that would determine not only Maria's professional future but also establish important precedents about the role of nurses in advocating for patients' safety when they disagreed with physician decisions. The conference room at Naval Medical Center was unusually crowded for what was typically a routine disciplinary hearing. Admiral James Mitchell had requested to attend Maria Santos' professional conduct review, and his presence had elevated the proceeding to a level of scrutiny that none of the participants had anticipated. Hospital administrators, nursing supervisors, and medical staff members filled every available seat, while others stood along the walls to witness what had become the most significant professional ethics case in the hospital's recent history. Dr. Harrison Webb sat at one end of the long conference table, his lawyer beside him reviewing the formal complaint that had initiated this hearing. Across from him, Maria Santos sat with a union representative, her 15-year career at the hospital hanging in the balance. The charges against her were serious: insubordination, failure to follow proper chain of command, and disruption of surgical procedures.
Each charge carried the potential for suspension or termination.
Admiral Mitchell had been released from the hospital 3 days earlier, but he had specifically requested permission to attend this hearing as a witness. His recovery had progressed remarkably well, with no signs of recurring infection and steadily improving strength. The surgical site had healed cleanly, and Dr. Peterson had pronounced him medically cleared to gradually return to his military duties. But the Admiral's focus was not on his own recovery, it was on ensuring that the nurse who had saved his life received fair treatment. Hospital Administrator Dr. Margaret Chen called the hearing to order, explaining that the purpose of the proceeding was to determine whether Maria Santos had violated professional conduct standards during Admiral Mitchell's surgery. The formal charges would be presented, followed by testimony from witnesses, and then a determination would be made about appropriate disciplinary action. Dr. Webb's attorney presented the case against Maria, arguing that her behavior in the operating room had been unprofessional and potentially dangerous.
Nurse Santos repeatedly challenged Dr. Webb's medical judgment during a complex surgical procedure, the attorney stated.
She refused direct orders from the attending surgeon and created a disruptive environment that could have compromised patient care.
The attorney continued by emphasizing the importance of maintaining proper hierarchy in medical settings.
Operating rooms require clear lines of authority and absolute trust in the attending surgeon's decisions. When nurses begin second-guessing physician judgment, the entire system of medical care breaks down. Dr. Webb testified about the events in the operating room, describing Maria's behavior as insubordinate and disruptive. He acknowledged that the patient had indeed been suffering from necrotizing fasciitis rather than simple appendicitis, but he argued that this didn't justify Maria's refusal to follow his instructions during the surgery. "I have 20 years of surgical experience," Dr. Webb stated. While the final diagnosis proved different than initially suspected, the proper protocol would have been for Nurse Santos to share her concerns privately rather than challenging my authority in front of the entire surgical team. However, when questioned about the patient's outcome, Dr. Webb was forced to admit that Admiral Mitchell might have died if the surgery had continued along its original course. This admission created a tension in his testimony that didn't go unnoticed by the hearing panel.
Maria's union representative presented her defense by focusing on the fundamental principle of patient advocacy that governs nursing practice.
Maria Santos has an ethical obligation to advocate for patient safety, even when that means disagreeing with physician decisions, the representative argued. Her actions were motivated by genuine concern for Admiral Mitchell's welfare, and the positive outcome proves that her clinical judgment was correct. The representative called several character witnesses who testified about Maria's 15-year history of excellent patient care and professional conduct. Colleagues described her as someone who consistently went above and beyond in caring for patients and who had never before been the subject of any disciplinary action. When Maria herself took the stand, she spoke with quiet dignity about her actions during Admiral Mitchell's surgery.
"I understood the professional risks of challenging Dr. Webb's diagnosis," she testified.
"But I also understood that Admiral Mitchell's life was in immediate danger, and I believed that my clinical observations could help save him." Maria described the specific signs that had led her to suspect necrotizing fasciitis: the unusual bleeding pattern, the extent of tissue inflammation, the patient's elevated white blood cell count, and his history of flu-like symptoms preceding the abdominal pain. Her detailed explanation demonstrated the depth of her clinical knowledge and the careful observation that had led to her concerns. "I have the greatest respect for Dr. Webb's surgical skills," Maria continued. "But I also have a professional responsibility to advocate for my patients when I believe their safety is at risk. I would make the same decision again under similar circumstances." The hearing panel listened carefully as Maria explained her thought process during those critical moments in the operating room. Her testimony revealed someone who had weighed the professional consequences of her actions but had ultimately decided that patient welfare had to take precedence over personal safety. Then, Admiral Mitchell was called to testify, and his presence immediately commanded the attention of everyone in the room. Despite still showing signs of his recent illness, he carried himself with the bearing and authority that had made him one of the Navy's most respected officers. "Ladies and gentlemen," Admiral Mitchell began, "I stand before you today because Nurse Santos had the courage to challenge authority when she believed a life was at stake. In the military, we call that moral courage, and it's one of the highest virtues a person can demonstrate." The Admiral's testimony was powerful and compelling. He described his understanding of the events that had occurred during his surgery and his deep appreciation for Maria's willingness to risk her career to save his life.
"Nurse Santos exemplifies everything we should want in a medical professional," he stated.
"She combined clinical expertise with genuine compassion and the courage to act on her convictions."
Admiral Mitchell then addressed the question of hierarchy and authority in medical settings.
"I understand the importance of chain of command better than most people in this room," he said. "But I also understand that blind obedience to authority can cost lives.
There are times when junior personnel must be willing to challenge senior leadership when they believe lives are at stake."
The Admiral's military perspective brought a unique dimension to the hearing. "In combat situations, we train our personnel to think independently and to speak up when they see problems that their commanders might have missed. Nurse Santos demonstrated exactly the kind of initiative and moral courage that we try to develop in our military personnel."
Admiral Mitchell concluded his testimony by directly addressing the hospital administration. "If you punish Nurse Santos for saving my life, you will be sending a message that patient advocacy is less important than professional hierarchy. I don't believe that's the message this hospital wants to send." Dr. Peterson was called as an expert witness to provide medical context for the events that had occurred. As the infectious disease specialist who had confirmed Maria's diagnosis, he was uniquely qualified to assess the clinical aspects of the case. Nurse Santos' identification of necrotizing fasciitis was absolutely correct, Dr. Peterson testified.
The signs she observed were subtle but significant, and her clinical judgment likely prevented Admiral Mitchell's death. The infection was aggressive and would have spread rapidly if not treated appropriately. Dr. Peterson also addressed the question of professional protocols in medical emergencies. While we certainly value proper chain of command in medical settings, we also recognize that patient safety must be the overriding concern. When a healthcare professional identifies a potentially life-threatening situation, they have an ethical obligation to advocate for the patient. The hearing panel deliberated for over 2 hours, weighing the competing interests of professional hierarchy and patient advocacy. The case had highlighted fundamental questions about the role of nurses in medical decision-making and the appropriate response when healthcare professionals disagree about patient care. When the panel reconvened, Dr. Chen delivered their decision. After careful consideration of all testimony and evidence, this panel finds that while Nurse Santos' method of challenging physician authority was unconventional, her actions were motivated by legitimate concern for patient safety and ultimately resulted in saving Admiral Mitchell's life. The panel continued, "We recognize the importance of maintaining proper protocols in medical settings, but we also recognize that patient welfare must be the primary consideration in all healthcare decisions." Nurse Santos demonstrated exceptional clinical judgment and moral courage in advocating for her patient. The final decision was that no disciplinary action would be taken against Maria Santos. Instead, the panel recommended that the hospital develop new protocols for handling situations where healthcare professionals disagree about patient care, ensuring that patient safety concerns can be raised and addressed without fear of professional retaliation. Dr. Webb's complaint was dismissed, though the panel noted that all healthcare professionals could benefit from additional training in collaborative decision-making and patient advocacy. The decision represented a significant victory for nursing autonomy and patient advocacy rights. Admiral Mitchell was among the first to congratulate Maria after the hearing concluded. "Thank you for fighting for me when I couldn't fight for myself," he said, his voice filled with emotion. "Your courage under pressure reminds me of the best military personnel I've had the honor to command." Maria felt overwhelming relief as she realized that her career had not only been saved but that her actions had been vindicated by the hearing panel. More importantly, the hospital's decision to develop new protocols for handling clinical disagreements would help protect other patients in similar situations. In the weeks that followed, Admiral Mitchell made a complete recovery and returned to his military duties. He maintained contact with Maria and her family, developing a friendship based on their shared experience and mutual respect. Sarah Mitchell sent flowers to Maria on the anniversary of her husband's surgery, thanking her again for the courage she had shown when it mattered most. Dr. Webb eventually approached Maria to apologize for his behavior during the surgery and the subsequent hearing. "Your clinical judgment was better than mine that day," he admitted. "I let my ego interfere with patient care, and I'm grateful that you were strong enough to speak up despite my resistance." The case became a teaching example in medical ethics courses, illustrating the importance of patient advocacy and the need for healthcare professionals to challenge authority when patient safety is at stake. Maria was invited to speak at nursing conferences about her experience, sharing lessons about moral courage and clinical judgment with other healthcare professionals. Admiral Mitchell continued to credit Maria with saving his life, and their story became an inspiration to military personnel and healthcare workers alike. The case demonstrated that sometimes the greatest act of service is having the courage to challenge authority when lives are at stake, regardless of the personal cost. Maria Santos returned to her nursing duties with renewed appreciation for the importance of her role as a patient advocate. She continued to provide excellent care while also serving as a mentor to younger nurses, teaching them the importance of clinical observation, moral courage, and unwavering commitment to patient welfare. The story of Admiral Mitchell's surgery became a reminder that heroes come in many forms, and sometimes the most important battles are fought not with weapons or military strategy, but with knowledge, courage, and an unwavering commitment to doing what's right when it matters most.